Hello, are you Laura Smith? Yes? My name's Isabella Ravio. I'm a student nurse from JCU, and today we've arranged this telehealth appointment, right? Yes? Perfect. So, Miss Smith, just a few things to confirm before we start our appointment. Your date of birth is 1702-2005. Alright. And your URN is 123456789. Okay. Miss Smith, I understand that you've recently been diagnosed with depression and your doctor has prescribed you fluoxetine. Yes? Okay. And you also live rurally, so that's why we're having this little telehealth appointment. Well, I'm glad we're able to do this and we can talk about your new medication. Well, Ms. Smith, I know the goals today are to make sure that you understand how fluoxetine works, including its intended benefits and the effects that you may notice during treatment. Ms. Smith will understand the potential side effects of fluoxetine and how these may affect her willingness or ability to continue taking the medicine. Ms. Smith, do you know what fluoxetine is or what it does? No? Okay, well, fluoxetine is a type of antidepressant that is often used to treat depression and sometimes OCD, or obsessive compulsive disorder, and bulimia. Well, you recently left high school, didn't you, Miss Smith? Yeah? So how much do you remember about presynaptic neurons from, high school science? Well, presynaptic neurons do come into play here with your medication, because the active ingredient fluoxetine hydrochloride is a selective serotonin reuptake inhibitor, an SSRI. This means that it exerts its antidepressant effect by blocking the reuptake of serotonin in the presynaptic neurons. This blocks the reuptake transporter protein in the presynaptic terminal. I know, when we said we would never use that science again, we did. This is going to mean that fluoxetine will take about 4 to 6 weeks to work, and you'll notice it starts to work if you feel a bit more energized and happy, which is a better improved mood. And due to fluoxetine's action on the reuptake of serotonin, it produces an activating effect. That activating effect again is going to be that happy, energized, alert, and mentally active feeling. So it's going to make you feel good, hopefully. If not, please call us and we'll try to figure out what's going on. Alright, Ms. Smith, now that you know more about what's happening inside your brain when you take fluoxetine, let's talk about actually taking fluoxetine. Your doctor has prescribed you 20 milligrams a day, which is equivalent to that of one gel capsule, which you can see just above me right here. Something similar to that you're going to get from your chemist soon. It is best that you take it in the morning to prevent difficulty of sleeping, which is a side effect. And it is recommended that you take it at the same time every day, as that will have the best effect. This also helps with remembering to take it every day. It's important that you keep fluoxetine in a cool, dry place that stays below 25 degrees Celsius when you store it, and keep it out of reach from children. While you can drink alcohol when taking this medication, it can make you feel sleepy, and it is recommended that you do not drink for the first few days so that you can monitor how the medication affects you. It is also important that you monitor your supply of fluoxetine to avoid running out on days that the chemist is closed. You can also ask your parents to help you in terms of monitoring how much you have and reminding you on when to take it. Now, what do you do if you miss a dose? While it's not ideal that you would miss a dose, it's not the end of the world. If you miss a dose, it's okay. Just take it at the next time that you're supposed to take your next dose. Then skip the dose you missed. Or if it's really close, an hour after you're supposed to take your dose, then just take it right away. And then the following day, take it at the same time you would have normally taken it. But make sure that whatever you do, see the big bold words? Oh, big bold words over there? Do not take double the dose to make up for the dose you missed, because that can lead to overdosing, and we do not want that happening to you. And speaking of other medications and taking too much, please contact us over here if you start taking any new medications, as they may interact negatively with fluoxetine. And I know before you've already established with us that you are not on birth control and you have no intention of getting pregnant or being sexually active. But if you start trying to get pregnant, or if you accidentally get pregnant, it's important that you notify us and let us know, as fluoxetine may impact the development of the baby. Alright, let's talk about some common side effects and solutions to them. If you have difficulty sleeping, try taking it first thing in the morning. If you have any headaches, make sure to drink enough fluids, such as water or juice. You can take either paracetamol or ibuprofen to help. Headaches will usually go away in the first week. If it persists longer than that, then please contact us. Nausea or any vomiting, then maybe try taking your medication with or after food, and if it still persists after that, please come talk to us. Diarrhea, increase your fluid intake to avoid dehydration, and do not take any other medications to treat diarrhea without speaking to your doctor or your pharmacist. If you feel tired or weak, stop what you are doing and lie or sit down until you feel better. If this symptom does not go away after 1 to 2 weeks, then contact your doctor. If you have any anxiety or nervousness, if this does happen, then please call your doctor and they can look at changing your dose. And don't forget, you do have a therapist as well, I know, that you can reach out to and talk to, or services like Beyond Blue if you want to talk to them. And if you have increased frequency in urination, and depending on how frequent the urination is, your doctor might suggest putting you on a different medication. And if you have sexual problems like lower sex drive, contact your doctor and we will come up with a plan to address this. Okay, let's talk about some more serious symptoms, like the ones on this list. If you experience any of the symptoms from this list, please contact us or call 000 or go to the nearest emergency room. If you gain or lose weight without trying, if you have any deviations or changes from your normal period, if you have feelings of euphoria, excessive enthusiasm, or feeling of restlessness, and if you don't know what restlessness is, it's where you just can't sit or stand still and you have to get up and down. If you have any bleeding from the gums, bruises that appear without reason or that get larger, skin rashes, hives, itching, peeling, or blistering of the skin, if you cough up blood, find blood in your urine or vomit, or have black or red stool, or if you have a cut or nosebleed that does not stop within 10 minutes. If you have fast pounding or irregular heartbeats or chest pain, fevers or yellowing of the skin, also known as jaundice, and in some rare cases, people have anaphylaxis. If you experience any of those, this list below. Alright, Ms. Smith, it seems that we're coming to the end of our appointment time here. So before I go, I do just want to remind you we have another follow-up appointment on May 7th at 1 p.m., which is about 4 weeks from now, to see how you're doing on your fluoxetine. And if you have any concerns or questions about your medication, then please contact your doctor or speak to your local chemist. And if you notice your depression worsening, have thoughts or talks of suicide or self-harm, if you attempt self-harm or suicide, then please reach out to either me, your doctor, your therapist, a trusted person, or call 000 or head to the nearest emergency room. Or you can also contact Beyond Blue at any time above me here at their phone number, and there's a little hyperlink up there that says chat online, and you can download this really great app that's on your phone. It makes it much easier to talk to them. Well, Ms. Smith, it seems that we're at the end of our time here. I had a great time speaking with you today, and I hope you were able to learn a lot from this meeting. I'll see you in 4 weeks. Bye, Ms. Smith. Alright, well, it seems that we're at the end of our video. You're now here with me on the reference page. So please like and subscribe if you like this video, and drop a comment down below.